Hello, everyone, and welcome to Africa Fire Mission's weekly virtual training session. My name is Mike, and I'm the programs director here at Africa Fire Mission, and we're so happy that you took the time out of your busy schedules to join us for today's virtual training program. Today, we're joined by Errol Sianga. Errol's got a great background in fire and EMS. He works for AFM. He is our fire safety advocate. Previously, he's also worked as a fire service instructor, worked in EMS, worked in fire. Um, has a good background in all aspects of fire and EMS, and he's been doing a great job for us, getting out there, doing a lot of training, community fire prevention, school safety assessments, and all sorts of great work. So we're excited to have Errol share some of his knowledge today with us as we talk about the importance of documentation in the fire and EMS service. Before we get started with the training, let me just touch on an administrative note or two. If you stick around for at least 70% of today's training, which is usually about 40 or 45 minutes, I'll get you a certificate of attendance for today's class. If something happens, you lose network, you've got to respond to a call, or anything happens, you don't get that time in there. There is another way for you to earn your certificate of attendance. Uh, if you head over to our webpage at www.africafiremission.org, there you'll find a tab for resources. Go into the resources and the training materials, and you'll find a folder for the 2025 virtual training session. Inside there, you'll find links to all of our trainings that we've done so far this year, including today's. There'll be a recording of the training, and you can just answer a few questions to let us know that you watched the entire video and that you absorbed some of that content. And if you complete that, I'll send you a certificate of attendance for the training. So feel free to check that out. You can go back and complete any of the classes that you may have missed so far this year. Uh, at this point in time, I'm going to throw things back over to Errol for just a minute and ask him to get us started with a couple words of encouragement.
All right. Good morning, good evening, good afternoon, everyone. Welcome to today's session on the 8th of October, 2025. I just don't have much to say, but just a few words of encouragement. As we all know, in our religious walk of life, all the things that happened were documented either way that we seen through the prophets or the disciples. They were all documented. And for all of us to be good followers and to be good disciples, we had to read and also write down what all those events that took place. So all of us, I urge us all in our departments, in whatever we do, in our fire department, in our emergency medical department, in our day-to-day life, journal each and every morning when you wake up, when you get to your shift. You need to journal the activities that you've done properly, the activities that you've done wrong. It helps you to sit down and have an account of what do I need to uh, what do I need to improve on, and what do I need to pat my shoulder on the back and encourage myself and encourage my team. So my word of encouragement is all of us just keep reading, keep documenting, so that you get to understand what part of this life things are taking you. That's few words of encouragement I have for today.
Excellent. Thank you, Errol. Appreciate that. Just a couple other notes for you. The username that you're using right now on the screen is the name that's going to show up on that certificate I was talking about earlier. So if if you need to make a change to that, please go ahead and adjust that now so we can get those certificates looking the way you'd like. Also, if you're sharing the screen with some other people, I just dropped my email address into the chat. Go ahead and drop me an email and let me know who else is sharing that screen with you so that I can email you a certificate of attendance for them as well. Now, when we get finished with today's training at the top of the hour, that's the formal portion of our training where we stop the recording and things. We transition into tea time. And tea time is a time where you can ask questions about today's session, or you can just network with other firefighters from throughout Africa. Take a look In the chat already, we've got folks introducing themselves from a number of different countries and counties throughout Africa and the Middle East. So, great chance to do some networking. So, when we get to the top of the hour, if you've got the time in the bundles, invite you to stick around for tea time. It'll be hosted by Errol and myself for that networking opportunity. Uh, I think that covers most of our sort of administrative notes that we need. So at this point in time, I'm going to pass things back over to Errol, our fire safety advocate, to get us started with today's training.
Thank you very much, Mike. Uh, Ladies and gentlemen, I want us to jump straight to our presentation for the day. So, alrighty, just a second. Oops, there you go. So, can you all see my screen?
Yep.
Mike?
All good, Errol.
Okay, thank you. So today we're going to talk about the importance of documentation. So our main focus is why do we need to document? What's the importance of documenting? And what we'll see is some things to I've touched on so that we can also trigger our minds on what we need to work on. So basically, our first slides tells us that documentation stands as the silent guardian of an organization continuity. All of us are in an organization, either your fire department or in the EMS services. So whatever you write down, it acts as a silent guardian. So in terms of standing operating procedures, standing operating guidelines, and also rules and also manuals for us to follow. So it's the bridge between knowledge transfer among staff and the framework upon which growth and quality are built. Absolutely. All of us went through a system of education from the time we were born until the time at this moment you are at work or you're in your organization. So everything that you sat down, read, or were written to you, and how you taught yourself how to write and read, all these were documented by someone else. So in order for you to also make your department be have a continuity and also have a way, some order. So all these need to be written down. So also it transfers the knowledge from one staff to another. Now remember, it says no one is the no one no no one no one is the monopoly. You can't monopolize. Let me paraphrase it. No one is a monopoly of knowledge. Okay, so all of us have some skill set of knowledge, an idea in us. So when you write it down, it becomes a book, it becomes a manual, it becomes a guiding or a script for all of us to follow. So let's dive into our lesson for the day. That was our introduction. So right about now, the first statement tells us documentation supports quality management systems and compliance. In order for you to work well, you need to have quality, you need to give quality, you need to be compliant. So a robust document on system is the backbone that allows organizations to systematically manage their procedures and processes. So, and also it goes by saying this includes everything from employee training, records to quality audits, and it helps maintain a high performance level that meets both internal standards and external legal requirements. So when in your department you found a document that explained what you need to do in order for one to have to give out the quality services and also how to be compliant. So some of these things, like is mentioned down here in these three pointers, one is standing operating procedures, the SOPs, or others call them standing operating guidelines, SOGs. Okay, we have quality manuals, the ones that we all read so that we know in order for us to administer quality services, in order for us to give quality, we have to go to read this manual. For example, in the fire service, in the fire academy, when you're reading the manuals, there are different types so that you understand how from the initial stages to up to now when you're graduating from your fire department. The same with the emergency medical services. There are manuals where you read that has different topics and different procedures to be done. In as much as we are looking at the quality management systems and compliance, we need also to have audit reports so that you know, am I in line with making my procedures work, or am I out of line? So that I can sit down and collect and account for everything that needs to be done. That's why audit reports also are very important. It's also for short-term planning, mid-term planning, and long-term planning, and also to see where else are the gaps that can be sealed. Moving on to the next point, it tells us documentations ensures patient safety. For all those who are in the emergency medical services, remember, whatever was not written was not done. That's a very true phrase all of us are familiar with. So it helps also ensure patient safety by, number one, preventing contraindicating drug prescription. Yes, that's why all of us, when you get sick and you go to the hospital and you're prescribed some medicine, it's written down on that prescription paper. Take 2 tablets 3 times a day. Drink this syrup 2 teaspoons 4 times a day, so that it does not contradict the drug prescription, so that you go in line with the illness that you have. Number two, under the ensuring patient safety, it ensures continuity of care during provider transition. Absolutely true. When your shift has ended and you're off, you're going home and you're handing over to the next incoming shift, what do? You read out, your handing over process involves documentation. What you did from the time you entered your shift began until your shift ends, so that when we come in to take over from the shift that has left, now we read from where we begin from where you left, both in the emergency department and also in the fire department. It helps you to continue from where the rest stopped, and it's a transition, continuous thing. It serves as a vital communication between multidisciplinary teams. Absolutely. If you've gone through the incident command system, you'll get to see that whatever was not written was not done. And also writing the objectives down, writing the incident action plan, and also strategy and tactics, showing how the command system works, allocating resources. It's a tool for communication between multidisciplinary teams, so that they know what do we need to add, what do we need to deduct, what is it that we need from us as an institution that we need to put or add on to this incident, so that all of us can work to a greater goal. Patient safety is at the heart of healthcare, and an accurate documentation is a cornerstone in providing safe and effective care. Also, in the medical records are a comprehensive chronicles of patients' health journey, including diagnosis, treatments, and patient response. So this second point, refers to the moment one arrives at a hospital, the moment you're queued in at the hospital, or when you go to receive a patient. The first thing you enter, the name, the details, the personal details, then what needs to be done. So it is comprehensive. It goes on and on and on and on. And also, we consider the case of a patient with multiple allergies. That is now, if we want to give medication or we want to see from the record, what do we need to do? What do we need to act on? So we go back to what was written. So also you check if this person does this person have multiple allergies? If the incomplete records can lead to potentially fatal medical errors, all of us are advised to have a notebook and a pen. Why? So that any information that you have, you document it down on your notebook, so that when you go and sit down and you compile all the short notes and make it into you fill it in either in that patient care report or in that your run book or in that occurrence book, it becomes out neatly. If it's incomplete, now there will be fatal medical errors, there'll be fatal information when you're going to respond. That's why we all as responders, whenever you enter a shift, you need to have a notebook and a pen. Always I work with a notebook and a pen or a sticky note with me, so that I know at times you can be overwhelmed with too much information and your brain cannot absorb all that. What do? You document it down. Or you've seen something and you know, this one I need to put it down in my final document. You note it down. So all those small information, when you put them in a complete report, it reduces errors and omissions that were unnecessary. On the other hand, meticulous documentation can save the fire service stroke, the EMS provider. Absolutely. Do not be tired of documenting or writing down your information. Meticulously, straight to the point, write it correctly, neatly, and also legible where all of us can read. If you cannot use your pen and the paper, if you have your tablet where you type it correctly, wordings, also in terms of figures, so that it should be when someone is reading, they should not call you back, they should not turn you back, so that you need to do a lot of explanations. So that's why you need to be meticulous in your doing your documentations, so that we can continue with our day-to-day activity. In some aspects, documentation serves as a legal safeguard. For example, in emergency situations, healthcare providers rely on swift access to a patient's medical history. Also, documentation here isn't just paperwork. It's a critical tool that can mean the difference between life and death. A very good example, if a patient crashes and they need to do resuscitation, they quickly go to the file and see what was the medical condition for this person as it was written from the time the person was admitted in the hospital. What are the what type of drugs is this person allergic to? What any other information does it need to be known, so that we can do resuscitation? And apart from that, also, it helps also in case we need consultancy or we need additional help from assisting agencies. The importance of patient safety documentation also extends beyond the individuals. It contributes to a broader understanding of care quality and treatment outcomes, thereby informing future healthcare policies and practices. I can extract example from all of us. We remember COVID-19, the pandemic. All of us were not familiar with how to handle ourselves the time it happened. But later on, years has passed on, when all those everything that happened during that time has been documented. So the treatment outcomes, also the quality care, the policies and the practices that have been written there in case such a kind of a pandemic happens, all of us will have a book or will have a manual reference, so that again we can protect ourselves. In the event of a legal dispute in which all of us, we don't pray to go to get to this level, it's never interesting. It's a very tiresome journey. It's very energy draining. It's financially draining. And also sometimes it also destroys your career. So we don't pray for anyone to get into legal dispute. Documentation after becomes the deciding factor in court cases. Aha. Pause a little bit. Question to all of us. I need all of us to think. When you're at work and you went for a run or you went to for a rescue, and then you given your department's book, and after filling it, you left some gaps here and there. What do you think might happen in case a court case happens? Will it be something good or will it be something negative? So that's why all of us, I urge all of us, whenever you're doing documentation in your department, never leave gaps, never leave blanks. Fill in all those spaces correctly. If you're not sure, you can write not applicable or it's none, or you put a narrative there that explains it gives a flow of the literature of what you did, so that we avoid this legal dispute, and also it becomes not a situation whereby your report is the one being used to make a deciding factor. So let's move on. It provides concrete data stamped evidence that can substantiate an organization or individual's narrative. Very true, as I've explained. It also moves on and says, precise records can protect against wrongful accusations. Exactly. That's why I mentioned whenever you're documenting, write everything correctly. If, for example, your handwriting is not legible, you can write in capital letters, in which are capital letters, block letters, which is at least does not make handwriting not to be legible. It's easy for you to read and understand. So also it goes on and say, let me repeat it again. Precise records can protect against wrongful accusation and are indispensable in disputes related to contractual agreements. Yes, when you're being employed or you're going for a short contract, liability issues, or professional malpractice claims. Another example, in a scenario where a client sues a fire department or an ambulance service for negligence, having detailed service records can help you a lot. Okay, so this, in the day-to-day societies, we are living in the world where all the clients that you're dealing with are very well informed. You're living in the information technology world, whereby when you want to administer care, when you want to administer your services, either as the fire department or as an ambulance services, your client knows what exactly needs to be done. So if you do the wrong thing or if you administer the wrong services, and then they document it down, either through writing or through pictorials or through videos, they will use it against you, and then it becomes negligence. And now remember, when you face a charge of negligence, it's never easy for your career. Also, it says that it reflects on the diligence put into maintaining safety standards. Yes, safety, 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 safety. Maintain safety standards and all will be well in your records, in your documentation, in your work, day-to-day work. It also counters false claims with concrete evidence. Where is the evidence? In your documentation, in your documents, in your patient care report, in your fire department's report after run, in your occurrence book. All those concrete evidence are there. From the time you are called upon, from the time you responded, you arrived, what you did, you wrote all the narrations in the literature, and everything is documented down. So when they go open it and scrutinize it word for word, and each and every event, it becomes a concrete evidence, so that you're not sued or taken for legal matters. So also documentation, again, it helps to, sorry, just a little bit. Okay, there you go. Continuity of face, the knowledge continuity. Documentation helps in a knowledge continuity in the face of team changes. For examples, process manuals, project reports, strategy documentation, and training materials. Okay, that's where we get it from. That's where we also all of us get to see what we need to do, how we go need to move on. Documentation maintains consistency across repeatable tasks and procedures. Okay, like when you enter you enter a shift, what do you need to do? You need to have a checklist. You need to have a handing over report when you're going out of shift. And also, in case there's an incident, you need to fill that incident report. So it says clear documentation lays down the expectations for performance and operational goals, making it possible for everyone within an organization to understand what is required of them. So no duplication of efforts, no duplication of duties. It also clarifies the clarity is essential for aligning the efforts of individuals and teams towards common objectives. We all have different strengths, so we as individual and as a team. So when it's documented on how we need to coordinate amongst each other, we do not find ourselves at loggerheads. So standard recorded in documents guide the quality of work and serves as a reference point for measuring success. Absolutely. The way we have turnaround time, we have the way we say return turnaround time. Let me just base my example on turnaround time. Documentation creates a clear trail of actions, decisions, and responsibility. This traceability is fundamental to establishing and reinforcing accountability within an organization. So traceability of what happens, and also it reinforce accountability. So as we get to this slide, I want us to have a small discussion. The points that are here in the fire brigade documentation, we have personal files, training records, exposure records, incident reports, maintenance records, schedule records, equipment inventories. I'd like us to have a small discussion on what type of documentation do you have in your department in relation to all this. We are not limited to all this. You can tell us what kind of documentations do you have? How do you go about it in terms of personal files, in terms of training records, in terms of exposure records, in terms of incident reports and maintenance records and schedules records, equipment inventories. So members, you can unmute where you are and also tell us what exactly do you in your department, how do you relate with this documentation? How do you note them down? Who is in charge of them? Where are they stored in terms of storage? And also, do you have them or don't you have them? If you
Before we
have them, how do they? Yes.
before we start with that discussion, let me just
Uh-huh.
touch on a couple of those items there. The
Okay.
personnel files, right? So these are going
Yeah.
to be information about, your personal information that your employer collects so that they can do things like payroll, and that sort of stuff. And then in that personnel file, you'll keep some of these other, you may keep some of these other records together with it, or they may be
Okay.
stored sort of separately, but you need some references to it. Obviously, the
Okay.
training records
Uh-huh.
should be documenting the training for individuals as well as documenting any kind of group trainings that you do. So if you're
Yeah.
doing a what we call a company level drill at the start of your shift where you practice pulling hose, that should be
Mm-hmm.
documented somehow, whether that's like a log book or however you decide to do that. Exposure records sort of tie in with the personnel file. An exposure record, I don't know if anybody's doing this, we'll talk about this in the discussion, but
Yeah.
exposure records is if you're exposed to some type of hazard that could cause you illness or injury down the road in later years, we record that in what we call an exposure record. So if if we respond to a hazmat incident that has a, some sort of a, dangerous chemical, you'll get an exposure report added to your personnel file, um, so that if there's complications down the road, if it can be traced back to your exposure to some sort of chemical or some sort of hazard, um,
Yeah.
it helps you with gaining medical care and things for that down the road. That's really important, to maintain those sort of exposure records. And
Yeah.
it's sort of a whole different discussion, but when we look at things like, um, when we talk about our topics like cancer prevention among firefighters and things like that, you can
Yeah.
begin to track, um, firefighters that get certain types of cancer. If you've got those exposure records and you can compare those, you can start to see some of those trends and see what might be causing some of those things that can help us then advocate for better PPE and things to try to protect us from those. Incident reports, there's a wide variety of ways that you can do different incident reports. Um,
Yeah.
you can, we do an individual incident report for each incident where we document who was there, what fire apparatus we took, what actions we took, all of that sort of stuff. um, they can also be just as simple as what we would call like a run log, where you're just documenting, what time you left, what time you returned, where you went, and what the call was for. So there's various levels of how you document those individual incidents. Maintenance records, we talked about maintenance and inspection of fire apparatus. I covered that topic a couple weeks ago. If you didn't see that training, go back and take a look at that one. We talk about maintaining records for that. Um, Scheduling records, maintaining some sort of records as to who was on staff. That ties in with your exposure records. It
Yeah.
ties in with your personnel files. So just keeping track of that. When Errol was talking about sort of your continuity of operations and how your good documentation helps the organization, carry on if there's a change in leadership or something like that, maintaining records of how schedules worked and things like that could be really helpful. Um, and then equipment inventories. You should have documentation of all of the equipment that's owned by the fire brigade, um, for a whole lot of different reasons. But that inventory list that's regularly updated when something's taken out of service, you mark on that inventory, the date it was taken out of service, the reason it was taken out of service, and then the final disposition of that. What happened to it? Where did it go? For accountability purposes and stuff like that. So, those are just some of the, a couple of examples. There's lots of other documentation, but we'll open the floor up now. Let me
Okay.
adjust some settings here, and let's have a conversation about what kind of records you guys are keeping. What did we miss in this list? What
Yes.
else are you guys documenting? And also, how are you documenting these different things?
Yes. How are you documenting? That's the main best thing.
And the idea behind one of the reasons we want you guys to share is so that you can share some ideas. If you're doing something in your fire brigade that's working well, maybe there's somebody on here listening that doesn't do the documentation and they can learn from how you're doing it. So please share with us how you guys take care of some of these records.
I can give an example about our process in the company.
Absolutely, please.
So as I'm working in oil and gas, basically all our documentation is electronically on K Drive. So we don't have personal files because we already have a company system for all individuals and people who's working with their staff number. We obviously we have training records, we have what we call drill reports, we have also familiarization reports. So it's including all the area visits we do to familiarize with wellheads and all the processing, oil and gas processing plants.
Okay.
We have incident report and many different files for some standard test for the equipment. For example, we have our maintenance, we have our training skills for each individual. So when we need to provide training to any personnel, we can just
Okay.
check this files and see who needs this training, who need to be sent for development, and we choose and nominate personnels upon it. We have also
Good.
different files. Actually, we have almost 45 different folders that keeping all, but there's some examples I can give.
Okay.
Excellent. Now, let me ask you a question with that. Are you using, there's companies out there that sell software that does sort of an overall records management. Do you guys use like one program that keeps
Yeah.
all of those different records, or are you maintaining just like separate spreadsheets or something?
Actually, we have both. We have special program that been established and created by a professional company, especially for our company. And also we have on K Drive different, Excel sheets and PDF files, some kind of stuff we use. Beside
Okay.
of the paperwork for truck and vehicle checklist normally.
Okay, great.
Great.
Great. That was something that we didn't have on that list that he had mentioned, was when you're doing
Yes.
the like fire prevention activities, or you're doing, not necessarily responding to an incident, but you're doing some other kind of related activity. Maybe you're doing inspections. He was saying, inspecting wellheads and things like that. So,
Yeah. Yeah.
yeah, great information. Who else? What else are you guys doing?
Yes. Feel free to unmute and share with us what you have.
Go ahead,
Yes,
Wellington.
Wellington.
Oh, good evening, everyone.
Good evening.
Good evening.
Okay. For me, it's a question to Miss. I think when he was explaining, I think he was talking of the logbook, or sometimes we call it the occurrence book. That when we are writing like the daily activities at the fire station, we are not supposed to leave a gap or to skip a line. Is that all?
Yes.
Okay? Was
Yes.
when I see sometimes, because I have an argument, say, guys, you're not supposed to leave a line, because someone can come and tamper with this, because it will be like a legal document. In case of anything
Yes.
that's happening, we are going to use that occurrence book or the log book for any investigation, or in the courts, you can use this one as a legal document.
It is a
So
legal document.
so thank you for the highlighting that point. Say thank you so much.
Thank you too.
Those are some great points. So when you're talking about some of that sort of record security and things like that, of course, when you're doing when you've using electronic means of recording stuff, there's always a trail in that of revisions that you can see sort of on the back side of that. So that helps to maintain that integrity. If you're not using a computer system, and you want to try to maintain some sort of integrity of the record, that's where they recommend what we used to do. Those type of records would be in a bound book, right? So it's in a book that's bound so that you can't remove the pages. And like Wellington was saying, you fill in each line, and then if someone was to try to tamper with the records, they would have to physically cut or tear a page out of the book. So that's a good way to maintain that sort of security of the records, to show that things were documented as they happened and there were no changes that were made at a different date, is if you keep those records in like a bound book, and like Wellington said, not skipping the lines or anything like that. So great
Yes.
contribution.
Yes. Thank you. The discussion is on. Tell us, what kind of documentation do you have? Do you use a manual where you write it, or do you have electronic? And how does it go about in your department?
Yes, Errol.
Yes, Simon, karibu.
Asante. Here in Moi, the
Yes.
Airport Rescue and Firefighting Services,
Yes.
we use a lot of manuals, but we also keep the soft copies of the same, just in case if they are. So they go hand in hand, the soft copies and also we keep them in the manual files.
Okay.
Yeah, and we have also some books that we also keep as records.
Yeah.
We have also we have files for daily open reports. Yeah, whereby the shifts that when a shift comes in, at the end
Yeah.
of the day, the duty officer has to fill the open watch reports. Yeah, and also we have the handing over books.
Okay.
And the daily information books also, that's for the shifts, whereby in case of any movements of equipments, they record in the information book. And also during the handing over books, also they hand over some items which are always in the office, and even the vehicles.
Okay.
And the checklists. So we have the occurrence books. The occurrence book, which is at the watch office.
Okay.
We also have visitors books. If you visit us, you have to record. You have to keep your records. Yes, when you visited us.
Yes.
Yes, and also now at the office, we also have a lot of files.
Okay.
Like the personnel files, whereby you need to keep the records for maybe driving licenses of the persons that you have. They are operating as pump operators, so that you keep track of their expiry dates.
Yes. 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 Yes.
Yes. Also, we have a file for budgets. We have budgets for every year, so we make sure that we keep records for our budgets. So when you are given a budget, you make sure that before the end of the year, you have consumed your budget.
You don't want to return any money?
No, we don't want to return the money. Then we have also drills file and the training files. So for the drills, we keep them as separate from the normal trainings. Yes. So we have training files, and then for the training files for our crews, and also training files for the stakeholders and or even other departments.
Okay.
Yes. So that's kept within the prevention office, fire prevention office. Yes. And then we have we have maintenance also records, which is also the files. Yes, maintenance records. Whereby we have a schedule for the maintenance of all the vehicles.
Yeah.
And also each vehicle has its own file for the maintenance, or even for to track any mechanical issues, breakdowns, and the repairs of the same breakdowns. Which other files do we have there? We have also files for memos.
Memos.
Yeah, if we make any memos for approvals to the top management, we make sure that you file. You file so that you can be able to track. You know, a memo can go and is misplaced somewhere, so you need to come back to your file to get the copy.
Okay.
Yes. Yeah, we have several files. I think I just mentioned a few.
Thank you very much, Simon.
Yes.
Thanks, Simon. That was great. Good stuff there. Some of the Yeah, internal documents, you know, different policies. We didn't even touch on that, you know,
Yes.
maintaining records of your policies, standard operating procedures, and that sort of stuff we've talked about in some of our previous trainings. Go ahead, Wellington.
Your hand is up, Wellington.
Okay, I thought I muted my mic. I'm sorry for that. Okay,
No, your hand. Yes.
Go ahead,
okay,
sir.
okay. On my side is just like in addition to what our instructor was saying on the list that
Yes.
they've provided for the document. But I need to add another document that we have here. We have PTW, permit to work. We
Permit to
provide
work.
yeah, permit to work system here. So we have the document for that. Our main document may be a person had signed, and also on the we do also on audit side. So
Yes.
we'll go in the field like I'm in the fire, I'm in the hydrocarbon chemical plant. So you go in the field, you do the audit again. After that, you need to file all those documents. I mean, what are the hazards you've identified, and what are the corrective measures if you are done? And also, did you able to close the observation on the site, or you need maybe a higher rank to do that? All those things you document, and also it helps it for us for the preventing for any emergency. So there's other the documents we are using at my workplace.
Wow. Do you have an exposure report or an exposure kind of report from your end? How do you call it?
Okay, like exposure report now, like now, that one is left to the environment guys. That's the one who are
Okay.
conducting that that side, because we have the guys for the environment. And
Okay.
those we have all those are the documents.
Okay.
Yeah.
Anyone who deals with oil and gas, what's the name of your exposure report? Or are they just written exposure reports?
Actually, we don't have, because we have special team for hazmat and
Okay.
yeah, but normally every personnel have their own protective equipment, like they have their gas detector for H2S. So when they have,
Yes.
when we don't have specific process for exposure, because once the alarm on the detector activates, we evacuate. We don't be staying there. Only the operator people they have in the plant.
Okay.
So what if somebody gets accidentally exposed to something, or you know there was the PPE failed or something? Is there some kind of a documentation there? You know, for me personally, like I want to be sure that anytime I'm exposed to that bad stuff, somebody's taken note of that so that we can, you know, track that down if I have health problems later on.
Actually, we don't have it, to be honest.
Okay, interesting.
What we do for ours, we do
Yes.
after we're done with the well,
Yeah.
we do a post well analysis, which documents all the hazards that were present during that well.
Okay.
So if we do have an employee that comes back with some of the long-term impacts from H2S, we can go
Yes.
back and look at all the wells they were on and count up, they were on, 50, 60 wells that had H2S present, even though it might have been a small concentration. Because in OSHA in the United States will let you work for 8 hours with 10 parts per million H2S. And you don't need any sort of protection against it. But they say that that's safe. but you still could have that long-term impact of it. So we document that when we're done when we're done with our well, and we turn our well back over to the customer. But it's the exposure things is a big deal. Like in the United States, OSHA has several federal laws written in the Code of Federal Regulations about exposure reporting. And part of the reason is we don't know what the chronic condition will be. The perfect example the firefighters are facing right now for this is lithium-ion batteries. A byproduct of lithium-ion well, first off, there's two ways to deal with lithium-ion batteries right now. You either put a whole bunch of water on it or you let it burn. Those are like the two things that we're trained on doing, right?
Yes.
So if you let it burn, you're exposing yourself to that smoke, and that smoke has hydrogen fluoride in it.
Yes.
So the chronic exposure to hydrogen fluoride, chronic being the long-term impacts of hydrogen fluoride, is respiratory issues. So when you get to retirement, it could feel like you're breathing through a straw because you have COPD and a lot of those long-term issues, right?
Yes.
And if it's documented that I went to 20 fires that were lithium-ion fires, we know that hydrogen fluoride is a byproduct of lithium-ion fire, then that will be a work-related issue, and your work will cover you to get fixed and to become healthy again and to pay for all those medical expenses. But let's go to the other one. If that's letting it burn and breathing in the smoke, which we try not to breathe in smoke, right? But say we put a whole bunch of water on it.
Yeah.
What happens when we put water on that hydrogen fluoride? It becomes hydrofluoric acid. Okay.
Yes. Reaction.
That's the same stuff that Saddam used to torture his political opponents, right? He gave them the hydrofluoric acid bath, and it's a flesh eating acid, and it's really, really, really bad stuff for you. Obviously, if you're exposed to that, it goes without saying, you could have major health impacts the rest of your life because of it. So lithium-ion batteries, when it comes to firefighting, is such a new issue that we really don't know what those chronic type things will be. So it's important to start documenting it now that you went to a lithium-ion fire, and then if it goes on in the future, it'll be covered. Because hopefully in the future we know in like future generations of firefighters, they'll just have the proper PPE to handle it, the proper air packs, whatever. But we're kind of like the guinea pigs. We're the ones that have to figure it out so you keep future firefighters safe. So yeah, that exposure reporting is a big deal.
Yeah. Okay. Well, thank you very much, Brian.
One last question or sort of topic before we wrap things up. To mention records retention then. Here where I'm at, we're governed by state law that would, and OSHA standards and federal standards that tell us how long we have to maintain the various records. Things like personnel files and exposure reports, those need to be permanently kept. Some of the files that you keep are listed as you have to maintain them as long as they're administratively useful, right? So maintenance records on your vehicles and things, if you no longer possess them and they're not administratively necessary, you can get rid of them. Other records, for us here, for whatever reason, have this sort of arbitrary 7-year rule. That's for all sort of municipal government records. The general rule is 7 years to keep them. So, that's something that you should take a look into. as you're thinking about the importance of documentation is how long do we have to keep these? And there's lots of different ways that you can maintain those records. Now, you can use your cellular phone works, your mobile phone works as a scanner to scan paper documents. So you can make electronic copies of some of that old documentation. It makes them very easy to save, on a computer, or even better yet, on something like a thumb drive that you could store those records. So think about how you're going to maintain those records and how long you should maintain those records, and ask some questions if there is any legal requirements in your area. Errol, are you aware of any of those legally mandated times? Do you guys have anything like that?
Yes, the others that stipulate 10 years, 10 years storage. Now make sure where you've stored your documents, it's a tightly closed environment, away from rats, water leakage. Of course, dust will be there, and also some rodents. But I think after 10 years, you're allowed to either dispose, or the way you do, you synchronize them and put them in an electronic kind of a file. Then now you store them far away, either in the Google Drive or in the cloud up there.
Good.
Yes.
Any other sort of closing thoughts before we wrap things up for today? All right. Let me get things wrapped up. The formal portion of our training. We start with an invitation. Stick around. We're going to carry on the discussion a little more here as we transition into our tea times. If you've got the time in the bundles, please stick around for that. Thank you to Errol for sharing his perspective on documentation. Really, this is an important topic. Great habits to get into. Great way for you to gather information, to advocate for your needs and things like that. So please start those discussions back in your fire brigades, at your ambulance service, to make sure that you guys are properly documenting things to put you guys in the best position to serve your communities. So thanks to Errol for teaching and sharing today, and thank you to all of you for joining us for today's training. We don't take for granted the fact that you're taking your time, and a lot of times your personal bundles, to get on here and use your data to connect with us. So we really appreciate that. We have plenty of seats available here in the training. So head on over to our webpage, www.africafiremission.org. Go to the resources tab under training materials. There's just tons of free resources available for you guys. That whole resources tab is for firefighters. All the information there is free to use, to share. So please take a look at that and share that registration link for this training if you think that there's others that may benefit from today's training, or from these trainings that we do each week. So thank you all. I'm going to wrap things up today. Stick around for tea time if you've got the time, and I hope to see you all again next week.